What is excessive blood clotting? Hypercoagulation. When you have a cut or wound, your body naturally creates blood clots, which are thickened masses of blood tissue. These clots are essential in stopping the bleeding. Proteins in your blood, called fibrins, team up with small fragments of blood cells, known as platelets, to form these clots. This process is called coagulation or clotting, and it helps your body effectively seal the injury and prevent further blood loss. Once the bleeding has ceased and the wound starts to heal, your body is supposed to break down and remove these clots. However, there are instances where blood clots form too easily or fail to dissolve properly. When this happens, these clots can travel through your body, impeding or completely blocking blood flow. Excessive blood clotting, also known as hypercoagulation, can pose serious health risks by restricting or blocking blood flow in the body. Blood clots have the potential to travel to various organs and tissues, including the brain, heart, kidneys, lungs, and limbs, leading to severe complications such as heart attack, stroke, organ damage, or even death. In this video, we'll explore each of these risk factors in detail, as well as their impact on your health. Understanding your individual risk factors is crucial for preventing blood clots and maintaining your overall health and well-being. 1. Overweight and obesity. Excess body weight doesn't just affect how we look. It also impacts our health, including our blood clotting risk. When you carry extra weight, your body undergoes various changes. These changes can lead to inflammation, which is like a simmering fire inside your body that can make your blood more likely to clot. Additionally, being overweight can affect how your blood vessels function, making them more prone to forming clots. 2. Advanced age. As we grow older, our bodies go through many changes. Some of these changes affect how our blood behaves. For instance, our blood vessels may become stiffer and less flexible, making it easier for clots to form. Plus, our blood clotting system can become more active as we age, putting us at a higher risk of developing blood clots. 3. Pregnancy. Pregnancy is a miraculous time, but it also comes with some risks, including an increased risk of blood clots. When you're pregnant, your body goes through significant changes to support the growing baby. These changes can affect how your blood clots, making you more prone to forming blood clots, especially during and after childbirth. 4. Prolonged immobility. When you're stuck in one place for a long time. Like when you're recovering from surgery or lying in a hospital bed, your blood can become sluggish. This sluggishness can make it easier for clots to form in your blood vessels. That's why it's essential to move around as soon as you're able after surgery or illness to keep your blood flowing smoothly. 5. Sedentary lifestyle. Sitting for long periods, whether it's during a car trip or a plane ride, can also increase your risk of blood clots. When you sit for too long, especially with your legs bent or crossed, it can slow down the blood flow in your legs. This stagnant blood is more likely to clot, particularly in the deep veins of your legs, leading to a condition called deep vein thrombosis, DVT. 6. Hormonal factors. Hormones play a significant role in how our blood clots. Certain medications, like birth control pills or hormone replacement therapy, can affect the balance of hormones in your body, increasing your risk of blood clots. These medications can make your blood more likely to clot, especially if you have other risk factors like being overweight or smoking. 7. Underlying medical conditions. Some medical conditions can make your blood more likely to clot. Conditions like cancer, diabetes, inflammation, and antiphospholipid syndrome, an autoimmune disorder, can all affect how your blood clots, increasing your risk of developing blood clots in your veins or arteries. 8. Dehydration. Staying hydrated is essential for many aspects of your health, including your blood clotting risk. When you're dehydrated, your blood becomes thicker and more likely to clot. Dehydration can also cause your blood vessels to narrow, further increasing your risk of blood clots. That's why it's crucial to drink plenty of fluids throughout the day to keep your blood flowing smoothly. 9. Genetic risk factors. You may be more predisposed to having a genetic cause of excessive blood clotting. If your family members have had dangerous blood clots, if you've had recurring blood clots before turning 40, Or if you've had unexplained miscarriages, you might be more prone to a genetic cause of excessive blood clotting. Other risk factors: diseases and conditions. Some illnesses and medical conditions increase the likelihood of blood clots forming in particular parts of your body. 1. Vasculitis. This disorder causes inflammation in the body's blood vessels. When blood vessels become damaged, platelets can stick to these areas and form clots, potentially leading to blockages. 2. Heart failure. When the heart is weakened or damaged, it may struggle to pump enough blood to meet the body's needs. This can slow down blood flow, creating conditions where clots are more likely to form. 3. Atrial fibrillation. Atrial fibrillation is a common heart rhythm disorder characterized by irregular heartbeats. In this condition, blood can pool in the heart's upper chambers, increasing the risk of clot formation. If these clots break loose, they can travel to the brain and cause a stroke. 4. Metabolic syndrome. Metabolic syndrome, a cluster of risk factors for heart disease, includes an increased tendency to develop blood clots, complicating overall health.